Welcome back. Well, right now we have someone who was on our show many years ago. Good to have her back, Ann Abdullah with the Laguna Hills Center for Sleep Apnea. Nice to see you again.
Nice to see you too.
It's a pleasure. And you've been doing this for several years now. Today I want to tell everybody you brought in a patient of yours, Don Voller. Nice to meet you, sir. So we are going to talk about sleep apnea.
Yes.
And everyone has probably heard about it, but really, what is it exactly?
So sleep apnea is a breathing disorder that happens during your sleep. And what happens is all the muscles in your body relax when you're in your deepest sleep.
Right.
The tongue is a muscle, so it falls back in the back of the throat and it blocks the airway. And so what happens is you stop breathing for at least 10 seconds at a time. And when you stop breathing, you don't get enough oxygen to your brain, to your heart. All the organs in your body are oxygen starved.
Yeah.
So night after night, year after year, it puts you at risk for heart problems, heart attack, stroke, Alzheimer's, dementia, diabetes, GERD, depression. You're 7 times more likely to get into a car accident because your sleep is fragmented. You never stay in the deep sleep long enough to feel rested. So it's really important to get it treated.
And as far as, you mentioned the causes, but is it just as we age? Is it maybe some medication that people are on? People are maybe just have a predisposition to have this?
So there's many different factors. One big thing is that as a nation, we've become obese. So the obesity rates have increased tremendously. And so even weight gain of 10 pounds would put you at risk for sleep apnea. And so what's happening is when you have weight gain in your neck, you can gain weight in the neck. And if you have a size 17-inch neck or greater as a male, that puts you at risk for sleep apnea because it puts pressure on the airway, and then the airway collapses. The other thing I wanted to mention that's really important is that when you gain weight, you can actually get fatty deposits in your tongue. So that will make the tongue fall back even more and block the airway.
Now, for years, people, there's been different devices, but there's the CPAP machine. And you have a different system here, an oral device, right? That, let's face it, the CPAP machine, for anyone who's ever seen one, the mask and the whole thing, it's not probably the most comfortable thing to sleep in. Probably feels a little confining and all, but you have something here that looks far, far better and easier.
Well, the CPAP machine is great. It is a very effective way to treat sleep apnea, and the way it works is by using pressurized air, and that forces the airway open. A lot of people will complain that the mask leaks at night, and that sound of the gushing air will wake them up. Or they unconsciously remove the mask in the middle of the night because they feel like they're suffocating. And so they don't get the benefit of using it when they pull it off at night, because that's when their sleep apnea is at its worst. What I have is the oral device, and the way this works is by moving the jaw slightly forward, and that mechanically opens up the airway. So as you move the jaw forward, the tongue goes forward with it, and it's less likely to block the airway.
Okay. So therefore, just because of that, it becomes much more effective.
Well, I wouldn't say it's more effective than the CPAP machine. It's equal. If you have mild or moderate sleep apnea, it would be equal.
All right. Now, as far as the device goes, how does this compare with any other device, a CPAP machine and things like that, as far as people are going to go, is this medically covered? We know the CPAP machine, can be medically covered, and we're talking about like insurance, Medicare, that kind of thing. Okay,
so most medical insurance will cover the oral device. They do have benefits for the oral device, including Medicare, and I am a Medicare provider.
Okay, that's good to know.
As far as other differences, with the oral device, you don't need electricity, you don't need distilled water, you don't need to lug it around if you're going through security at the airport. You could just stick it in your pocket and go through. So it's a lot more transportable than the CPAP machine.
Okay, and Don, how has this been for you? You use this, right?
Yeah, I have. The doctors, my doctors at least, determined that sleep apnea was a major contributor to my atrial fibrillation. Mm-hmm. So they had me tested for sleep apnea. It came out that I had a moderate case of sleep apnea, and they recommended the CPAP, which I tried for quite some time. Mm-hmm. And I never could get used to it. There was something about it that I found very difficult to get used to. So I stopped it, and I was just on medication most of the time. And my doctor one day just said to me, "Why don't you try an oral device? If you can't get used to the CPAP, there are options." And he suggested that. And so I investigated it and found Dr. Abdullah and got set up for an oral device, and it has worked remarkably well for me.
Yeah, you know, just looking at it here, if I may, it's, you know, it just almost looks like a small version of a mouth guard that people would use for various reasons. Both people sleep with those, but you know, sports and things like that. Very non-intrusive at all, and I can see where this would be far easier to use. And you know, the main thing is, whatever a patient is using that they have to implement themselves on a daily basis, the number one thing is that they use it, that there's you know, compliance on their part. They're going to be more apt to be comfortable and use this than they would the CPAP machine, as Dawn said. You know, it's just work for them far better.
You bring up a very important point.
Yeah.
So what I was saying before is that the CPAP is very effective, but if you want to compare compliance rates, patients are more compliant with the oral device because there's no unnatural air being blown down the airway. There's no mask and hose that you get tangled up with. So it's as easy as wearing a night guard. So you could sleep on your back, sleep on your side, sleep whichever way you naturally sleep.
That's fantastic.
And it's effective in treating them.
And obviously these are fitted to your jaw.
Custom made.
Yeah.
They're
Fantastic.
custom made, yes.
Now, as far as somebody who may be eligible for this, and in other words, this is going to really work for them, they would come to see you. You would kind of obviously go through their history and what they need. And if they decide to go with this, it takes a couple weeks for you to fit them and that sort of thing and get it going?
That's right. So all they need to do is just come into the office for a consultation, whether they have a sleep study done or not. We could always set that up for them. And then we just take impressions of their teeth, do a head and neck exam, and go from there.
That's fantastic.
Pretty simple.
Really good. I want to give your phone number here and website. The website is Get Off CPAP, so that's easy to remember. And the phone number is 949-768-1671. Where are you located?
We're in Laguna Hills, across from Gate 4.
Oh, okay. So really close by.
Makes it easy.
Yeah, very nice. Good to see you again, Ann.
Good to see you.
I know it's been a while. I'm glad you're back.
Thank you so
Dawn,
much.
a pleasure to meet you.
Pleasure to meet you too.
So again, it is Laguna Hills Center for Sleep Apnea. The number is 949-768-1671, and there is the website on the screen there, getoffcpap.com. So if you think you might have a problem with this, or probably your spouse can figure it out before you do, go in and say hi to Ann and see if she can help you out. All right, we'll be right back. Very good. Yeah, I can see where this was.